Welcome to SS2 Physical Education. This lesson covers sports injuries, their classification, common types, immediate treatment, price and harm principles, and rehabilitation strategies to return athletes to full fitness. Sports injuries are classified in several ways. By onset, acute injuries occur suddenly due to a specific incident, e.g., a sprained ankle from landing awkwardly, a fractured bone from a collision. The cause is usually identifiable and immediate. Chronic injuries develop gradually over time from repetitive stress, overuse, or poor technique, e.g., tennis elbow from repeated racket swing, shin splints from running on hard surfaces, swimmer's shoulder from overuse. Chronic injuries are often underestimated and undertreated because the pain builds slowly. By tissue type, soft tissue injuries, injuries to muscles, tendons, and ligaments. These are the most common type in sport. Bone injuries, stress fractures, small cracks from repetitive stress, complete fractures from acute trauma. Nerve injuries, compression or stretching of nerves, can cause numbness, tingling, or weakness. Joint injuries, sprains, ligament injuries, dislocations, joint surfaces separated. By severity, grade 1, mild, minor damage to a small number of fibers, slight pain and tenderness, full function maintained. Grade 2, moderate, significant but incomplete tear, considerable pain, swelling, and some loss of function. Grade 3, severe, complete rupture, severe pain followed by reduced pain, paradoxically, complete loss of function, often require surgery. The most common sports injuries encountered in Nigerian sport. Muscle strains, tearing of muscle fibers, most commonly in the hamstrings, posterior thigh, quadriceps, anterior thigh, and calf muscles. Caused by inadequate warm-up, muscle imbalances, one muscle group much stronger than its antagonist, fatigue, sudden explosive movement. Common in sprinting, football, particularly hamstrings in sprinting and jumping. Ankle sprains, the lateral ankle sprain, turning the ankle outward, is the most common acute sports injury. The lateral ligaments, particularly the anterior talofibular ligament, ATFL, are most commonly affected. Common in football, basketball, and any sport involving rapid direction changes. Knee injuries, anterior cruciate ligament, ACL, tears are severe injuries common in football and basketball involving sudden deceleration and pivoting. Patellar tendinopathy, jumper's knee, affects athletes doing repetitive jumping. Meniscus tears occur in contact sports. Stress fractures, partial bone cracks from repetitive loading. Common in the metatarsals, foot bones, in runners, the tibia in track athletes. Risk factors, rapid increase in training volume, low bone density, inadequate nutrition. Concussion, a brain injury caused by head trauma, common in rugby, boxing, and contact football. Symptoms, headache, confusion, memory loss, nausea. Any suspected concussion must be taken seriously and the athlete removed from play immediately. Knowing what to do immediately after a sports injury is critical. The price principle for acute soft tissue injuries: P. Protection. Protect the injured area from further damage, stop playing, use a support or splint if appropriate. A. Rest, stop the activity, avoid weight bearing if the lower limb is affected. I. Ice, apply ice wrapped in a cloth for 15 to 20 minutes, never apply ice directly to skin. Ice burn risk, reduces pain and swelling by causing vasoconstriction. C. Compression, apply an elastic bandage to reduce swelling, not too tight, check circulation. E. Elevation, raise the injured limb above the level of the heart to reduce blood pooling and swelling. What to avoid? The harm principle: the following increase swelling and damage in the first 48 to 72 hours. H. Heat, including hot baths, heat rubs, alcohol, running or vigorous exercise. M. Massage, in the acute phase. When to seek medical attention: any suspected fracture, a joint that appears deformed or dislocated, an injury that does not improve within 48 hours, any concussion, severe swelling, bruising, or inability to bear weight. Returning an injured athlete to full fitness requires a systematic rehabilitation program. The rehabilitation process has 4 stages. Stage 1, acute management, 0 to 72 hours. Price, pain and swelling management, gentle range of motion exercises if pain permits. Stage 2, early rehabilitation, 3 days to 3 weeks, depending on severity. Restore full range of motion, begin strength exercises, initially isometric, muscle contraction without joint movement, then isotonic, gentle cardiovascular exercise that does not stress the injury, e.g., swimming or cycling for a lower limb injury. Stage 3, functional rehabilitation, 3 weeks to 3 months. Progressive return to sport-specific movements, proprioception training, balance and coordination exercises. The proprioceptive system is often damaged in joint injuries and must be retrained. Gradual increases in intensity and load, sport-specific drills without contact. Stage 4, return to full activity. The athlete must demonstrate no pain at rest or during activity, full range of motion, strength at least 90% of the uninjured side, full proprioceptive function, ability to perform all sport-specific movements at full intensity. Return to play too soon is the most common cause of re-injury. Rehabilitation in Nigeria, access to physiotherapists, sports doctors, and rehabilitation equipment is limited at most Nigerian secondary schools and community sports clubs. Basic knowledge of price, injury recognition, and the principles of progressive rehabilitation enables coaches and athletes to manage most common sports injuries appropriately even with limited professional support. Today we covered sports injury classification, by onset, acute versus chronic, tissue type, soft tissue, bone, nerve, joint, and severity, grade 1 mild, grade 2 moderate, grade 3 severe complete rupture. Common injuries in Nigerian sport: muscle strains, hamstrings, ankle sprains, ATFL ligament, knee injuries, ACL, patellar tendinopathy, stress fractures, and concussion. Immediate treatment: price, protection, rest, ice, compression, elevation, and avoid harm, heat, alcohol, running, massage in the first 48 to 72 hours. Rehabilitation stages: acute management, early rehab, functional rehab, and return to full activity. For your WAEC examination, explain the price principle for treating an acute sports injury and identify 2 signs that should prompt referral to a medical professional.